Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of the NAAOP. Tremendous, significant time in Washington, D.C. with respect to health care reform. Just this week, the Senate introduced a repeal and replace bill to ultimately dramatically reform the Affordable Care Act. And there's a significant congressional briefing taking place next week that NAAOP has been instrumental in coordinating that we wanted to make sure you were well aware of. First off, the bill. The Better Care Reconciliation Act was released in draft form just yesterday and is expected to be introduced in final form early next week. The Congressional Budget Office report that scores the bill will also come out early next week, and the Senate is scheduled to vote on the bill sometime around Wednesday, Thursday, or Friday of the coming week before they go off for their congressional recess for the 4th of July holiday. This is an extraordinarily tight time frame. This is a bill that was developed over the past six weeks. It's received no hearings, so there is very few public analyses of exactly what these provisions in the bill would bring. However you feel about the Affordable Care Act, you need to know at least two things about the bill and how it impacts orthotics and prosthetics. The first is that it essentially repeals the Essential Health Benefits Package. And the Essential Health Benefits Package covers, as one of the categories of 10 benefits, rehabilitative and habilitative services and devices. That's language that has enabled our field to ensure that orthotic and prosthetic care has been covered by the vast majority of private health plans across the country. The ACA sets a federal standard for O&P coverage, and that is likely to go away under the new bill. Now, it doesn't mean that O&P coverage will dry up overnight. Many states will continue to mandate coverage of O&P care, but it doesn't bode well. It is certainly a shortcoming of the bill, and it will lead to reductions in coverage of orthotics and prosthetics over time. There's virtually no doubt. Same for the Medicaid program. The Medicaid program would be dramatically reduced in terms of spending, somewhere around $800 to $900 billion over a 10-year period. And right now, the Medicaid expansion program in all those 31 states that expanded the Medicaid program currently covers essential health benefits, i.e. prosthetic and orthotic care. And that too would be repealed. And so there is really no telling what those states would cover in terms of orthotic and prosthetic coverage if this bill passes. They expect, as I said, to move this bill very quickly. The Senate is expected to take a vote next week. If it passes, the House is expected to pass the Senate bill and move it to the President's desk. If it fails, it's really no telling what will happen from then on in. So that's the bill. It just so happens that we have been instrumental in planning a congressional briefing and Capitol Hill Day to bring to legislators our concerns about coverage of rehabilitative and habilitative services and devices. On Tuesday, the 27th of June, from 12:15 to 1:30, we will be hosting a briefing along with 60 organizations, national nonprofit health, disability, and rehabilitation organizations, to describe the value and to illustrate the value of rehab and HAB services and devices. We encourage you to participate in this briefing because we're going to live stream it. Please go to www.naaop.org on Tuesday and view live streaming of the congressional briefing on rehab and HAB services and devices. As part of the briefing, we're going to have Senator Tammy Duckworth and Congressman Brian Mast. It's a bipartisan event, both of whom are bilateral leg amputees as a result of war injuries. We'll also have one of the Boston Marathon bombing survivors, also with an artificial limb. I'll be emceeing the entire briefing. And we will have Eric LeGrand, who is a football player from the Rutgers team who sustained a spinal cord injury, as well as a few other witnesses. It'll be an hour-long briefing. We hope that it will move quickly and that people will really learn something and that will raise the awareness level of the importance of O&P and other rehabilitation coverage on Capitol Hill. This briefing will be coupled with demonstrations of technology. We'll have a B-bionic hand being demonstrated and a power knee being demonstrated, as well as the exoskeletal orthoses of exobionics. And so it should be a very good learning experience for congressional staff. We'll be sending the live link out shortly. We encourage you to participate in the briefing through the live streaming. Thanks so much, and we'll be in touch.